I'm Dr. Sonika Kanotra. I am professor in the Department of ENT and Head and Neck Surgery at SMGS Hospital.
Nowadays, every other person is using earphones, AirPods.
But there is one problem with these earphones because we put it directly into the ear, so they damage our hearing cells, which we call the hair cells of the inner ear.
Okay.
So once these are damaged, that leads to hearing loss. There's no need to use earbuds.
Okay.
The wax which is formed in the ear, it is a protective mechanism. So that we don't need to clean every day. Yes, once in a while it's okay.
Welcome to Dopamine High.
Thank you for inviting me.
How are you feeling today?
I'm great.
Can you introduce yourself for the audience?
Yeah, I'm Dr. Sonika Kanotra. I am professor in the Department of ENT and Head and Neck Surgery at SMGS Hospital in Government Medical College, JAMMU. And I have been in this field of ENT for the past 20 years now.
And if somebody wants to come to you and visit you personally, is there?
Yeah, I have my own clinic also.
Okay.
So I'm practicing at TRIKUTA, NAGAR.
All right. Nowadays, every other person is using earphones, AirPods. How can we prevent our ear health?
Yes, a very pertinent question in today's time because all kids, in fact, those working in offices also, they have their Zoom meetings after COVID.
Right.
There has been a rise in the use of earphones so much that people have been working from home itself. So they've been using wide-scale use of AirPods and all these earphones. But there is one problem with these earphones because we put it directly into the ear. So they damage our hearing cells, which we call the hair cells of the inner ear.
Okay.
So once these are damaged, that leads to hearing loss.
Right.
So it is always better to minimize the use of earphones.
Okay.
And your phones have a permissible audible limit.
Right.
So you should always maintain that limit. Do not exceed that limit. And avoid using earphones for more than 1 hour in a day.
Do you think headphone is better than AirPods? Because AirPods, as you said, directly it's in your ear, and headphones are still a little further away.
Both are equally bad.
Okay.
If anyone wants to use it, then you can use a headphone.
That's a better option. Right. Similar to this, a lot of people use earbuds, which could cause a problem, but still we use it.
Yeah, we use it because the earbud companies have been advertising them from a very long time. There's no need to use earbuds.
Okay.
The wax which is formed in the ear, it is a protective mechanism. So that we don't need to clean every day. Yes, once in a while it's okay, but not vigorous use. Do not vigorously itch your ears with the earbuds.
Right.
Because this can lead to infections, especially in diabetics.
Right.
Those who have ear itching, diabetics usually have ear itching and they start using earbuds, and that leads to infections which are sometimes become very difficult to control with even antibiotics, and we have to give injections for that.
Okay.
Yeah. So sometimes people who use earbuds, they can damage their drum also, what we call the tympanic membrane. And that can lead to a small hole in the tympanic membrane, and consequently you can have some problems with hearing. So it is not advisable to use earbuds.
You said diabetic people can get itching. How is diabetes related to ears?
Yeah, sometimes what happens is that the ears of diabetic people, they are very sensitive, and also the immunity of diabetics is low. So what happens is once there are people of the diabetics are also on sometimes on medications which can cause ear itching. Right. So that itching is because the pH of our external auditory canal, the area of the ear which itches, that changes in diabetics, and that leads to itching, and that is the reason for the infection also. So that change in pH, if the skin is traumatized, can lead to infections also. So diabetics need to be very careful about their ears.
Right. And pollution is on the rise, and it's affecting it's affecting our ear, sinus. How can we protect ourselves?
For pollution, yes, it is pollution, air pollution, definitely. Noise pollution for ears. And you need to protect yourself because whenever you go out in a dusty environment, always wear masks.
Right.
And if you have some known allergies, like people who have allergic rhinitis. So these people, they keep on sneezing, rubbing their noses, and watery fluids, it keeps on coming out of their noses. So these people, if they have itching, especially during the change of seasons, like March, April, and October, November, they need to take care of their allergies. That is very important. And in fact, if they go out in a polluted environment, like when there's smoke or dust, they all are irritants and they will increase your symptoms. So you need to wear masks and keep your allergies under control. For noise pollution, definitely there have been rules have been set up by the government, but nobody pays a heed to it. Honking,
Yeah.
no need. There's no. You shouldn't honk. All these loud noises. Avoid loud noises. Avoid going to DJ parties regularly because there's so much of noise that can damage your ears. And pollution, another thing, which is what we eat nowadays outside. So that damages our throat.
Right.
So all that spicy, oily foods and all those substandard masalas and whatever is being used, that damages our throat, and that can lead to frequent throat infections.
Talking about sinus, what is sinus and why is it so common nowadays?
Actually, sinus is a very layman's term which is used. It is any condition of the nose, whether it is allergy, whether it is nasal obstruction, whether you can't breathe through the nose, it's termed as sinus.
Right.
But in medical terms, sinusitis, it is a different thing altogether. So now coming on to sinus, I'll explain that sinus, if it is an allergy, the patient will have sneezing, itching, watery discharge from the nose. He might have cough and sometimes some breathing issues also. So that is allergy. So you need to identify the allergen to which the patient is allergic and treat it accordingly. So allergies can be kept under control with certain medications, but you need to identify or you need to realize that yes, you are having allergy. You need to see an ENT doctor who will also examine your nose. Secondly, sinusitis. If sometimes allergy is not being treated properly, that can lead to sinusitis. Now, what is sinusitis? Sinusitis, we have certain sinuses. These are empty spaces in our face, in our skull. So when this gets infected, that leads to sinusitis. So the patient might have nasal obstruction. He won't be able to breathe through the nose. He might have headache, nasal congestion. He will have some thick discharge, phlegm from the nose, recurrent sore throat. So these things, they all lead to, these are symptoms of sinusitis. Now, treatment of sinusitis is different as compared to allergic rhinitis, but in common man's term, both are labeled as sinus.
Okay.
Right. And the third thing is, sometimes the patient has nasal blockade, but no itching and no headache. So once you examine the nose, the patient might have a nasal deviation.
Okay. That's
So
something different.
that is something different. So that is what is, there is a bone which separates our two nostrils, so that separates the two nostrils. So it is supposed to be in the midline. So if it gets deviated to one side, so one side gets blocked, so it gets blocked. So if it gets blocked, the patient is not able to breathe. So that is also termed as sinus. Mujhe sinus ho gaya.
Okay.
So once you think that you have some nasal symptom, always see an ENT surgeon so that he can fit into you some diagnosis and treat it accordingly. Don't go on taking over-the-counter medications for sinus disease. I have sinus disease. So you need to consult an ENT surgeon so that he makes a diagnosis and treats you accordingly.
You've beautifully explained. I have learned so much from you because this is a very common problem. When you said the diversion in your nose, a lot of people actually have the problem in their nostril, but they actually term it as sinus. Right. Uh, often, recently I watched this reel. It said that if you put Otrivin in your nose regularly or quite often, you could get a BP problem. Is that true?
Yes, it is true, but then there are certain things which I would like to add on to it. Never use Otrivin on your own. Only if you are prescribed by an ENT surgeon, use Otrivin, because it is not a good drug to use.
Okay.
You might be having a deviated nasal septum and you are keep on using Otrivin. What help it will do to you? Because that diversion, that deviation is there, it will not straighten up, right? But the problem it is adding to your problem is that you are getting addicted to Otrivin.
Okay.
So that is a drug or habit forming drug. Initially, sometimes the patient has nasal blockage. He is prescribed Otrivin by some ENT surgeon. Only for 3-4 days he uses it, but he feels comfortable. He keeps on using it. Right? So what happens is, what does Otrivin do? Once you put the Otrivin into the nose, it shrinks our tissues.
Okay.
So once it shrinks the tissues, our airway improves. So the patient starts feeling comfortable, ignoring the basic problem. So it is just improving the symptoms. And after some time, after 10-15 days, you become addicted to it. Means that once you put Otrivin, your nose opens, and once it affects weans off, you again have that rebound congestion. So that becomes a vicious cycle. So you keep on putting Otrivin, withdrawing Otrivin, having its effect finishing off, you again put Otrivin. So this is something which we call as rhinitis medicamentosa, and it is a known entity. So then we have to treat that. So it is a habit forming, it is an addictive drug which should not be used regularly.
Right. For sinus, can you tell some exercises that can be done at home?
For sinus issues, you know what is neti? Neti, the douching. Yes. So for sinus issues and patients, in fact, with allergy issues, can do regular neti or douching, and that is very beneficial. Then some yoga asanas like pranayam, Anum Vilom. So they also help with in patients with sinusitis. That is.
In India, it's usually said that we are self-made doctors, or like we start Googling.
Yeah, so we are now
and
Google doctors.
and often, especially a medicine like Otrivin is used very commonly, very
Yeah, it's left, right, center. Even the chemist dispenses you Otrivin without knowing anything.
right.
The patient will go to the chemist. He will not spend money to for the doctor. So he will go to the chemist. He will say, my nose is blocked. Okay, you take this Otrivin, put it in your nose, and the patient is also happy. I saved my 500 rupees. So that is it. So that is because these OTC drugs, they should be avoided. You should not buy them on the counter.
Definitely. We were talking about sinus. I wanted to ask one thing. When we have sinus, this part gets swollen, and our throat, there's this itchiness in the throat. Why does that happen?
So again, you are using the wrong term, sinus. So once you have itchiness in the throat, it can be because of allergy also. Okay. Yes, sinus, you're right. You have pain here. You can have pain in the face. You can have pain in the head. Okay. Because our sinuses are here. So we have two sinuses here, two sinuses in the head, two sinuses near the nose, and one in the brain, near the brain. So any infection of these sinuses causes the face to be heavy. You will have facial heaviness. You can have headache. Headache, it could be in the front or it could be at the back. And once the sinuses is infected, it produces lots of secretions. So where these secretions they go into the throat. So they infect the throat also. That is why we are ENT doctors. Why? Because the lining of the ear, the nose, and the throat is same. It is all continuous. It's all connected. So that is why we are like that. So any problem with the nose will lead to a problem in the throat also.
On a lighter note, I just wanted to know, what's the worst case scenario that you've seen in terms of, have you seen like ants in someone's ears?
Oh, that is very common. Yeah. That's very common. And we have, it's very common, especially in monsoon season. When there is so much of insects and people, they sleep on the floor, they sleep on the terrace. So people come with mosquitoes, with flies, with big cockroaches.
Oh my god.
Yeah. In fact, we had moths. Yes, we remove them quite frequently. Yeah. So one advice I would like to give you, that if a live insect, it enters your ear, first kill it. Cut off its oxygen supply. Because once the live insect is inside, he's also troubled. So he keeps on moving, and that causes a lot of pain in the ear. So always put some eardrops if you have, or if you can put some oil in the ear, and just first of all cut off its oxygen supply so that he dies, and that pain of yours also gets better. And then you can go to any ENT surgeon to get it removed.
I didn't know it was so common.
It's very common. In fact, in the rural areas, people who drink water from the ponds. So what happens is once they just bend down to drink water from the pond, leeches. I really don't know whether you know what a leech is.
Yeah, I do.
So
Yeah.
the leeches enter into the nose.
Okay.
So that
And
leech
that causes nose
bleeds.
bleeding, right?
Yes, so that can cause nose bleeds. So we remove leeches also from the nose.
Okay. It's very common that people are vaping, smoking. How is it affecting our ear, nose, and throat?
See, tobacco in any form is not good. It is the most common carcinogen we know. It's a cancer causing
Right.
thing, right? And with the use of tobacco, widespread use of tobacco in the youngsters, and in fact, ladies now, females have also started smoking, there has been an increase in the head and neck cancer.
Okay.
So, head and neck cancer means cancer of the throat, the tongue, the mouth, right? Tonsil, the voice box, the lungs. So, in fact, the urinary bladder. So that is not my job, but still, just for awareness, for urinary bladder. So, there has been a rise in this cancer, and there has been a rise in India because initially ladies never used to smoke in India. There's only in the rural areas where ladies used to take hookah and all. That used to be anecdotal. But now there is a widespread use of tobacco. The only way to keep yourself away from all these diseases to avoid tobacco in any form, whether it's vaping, whether it's cigarette, bidi, pan, tobacco, khani, gutka, anything, any ulcer in your mouth, if you see it is there and it's not responding to treatment for 2, 3, 4 weeks or month, consult an ENT surgeon.
Okay.
It could be because of tobacco and it could be something which is not good. So we will need to investigate. Any change in voice, if your voice has changed and it is more than 3 weeks,
Okay.
consult an ENT surgeon. It could be something sinister. If you have some swelling in the neck, maybe if you have some nodes in the neck or some swelling in the neck, which is not responding to your routine antibiotics, you need to investigate. And this is for all, even for non-smokers also. But smokers are a risk factor. The smoking is a risk factor. So more so in people who smoke and who drink. So smoking and drinking, it increases the carcinogenic effect by 16-fold. Tobacco alone is 2 to 3-fold. It is a risk factor. But once you take tobacco with drinking, with taking alcohol, so it increases the risk by 16%.
So you said there are two things, vaping and tobacco, right? Is it, it's said that vaping is less dangerous?
No.
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 The effect
E-cigarettes,
is
e-cigarettes, vaping, everything is same.
okay. The effect is
The
the same.
effect is same. Maybe a person who has been smoking all his life will not develop cancer.
Mm-hmm.
And the other person who was just smoking, started smoking for 2, 3, 4, 5 years, develops cancer. So there comes a difference in the genetic makeup of the person. So this is not a generalized statement that everybody who smokes will get cancer, but smoking is a risk factor because there are certain genetic mutations. So cancer occurs because of some genetic mutations. Maybe you are prone to a genetic mutation that can lead to cancer.
It's said that your it affects your nose, and there's a lot of mucus because of smoking. Is that true?
See, what happens is once you smoke, the smoke that affects the working of the functioning of the nasal cavity. We have very small hair cells in the nose, the ear, and these the function of these are so small that you can't see them with the naked eye. They can only be seen under a microscope. So what is the role of these? These are called cilia. So what is the role of these cilia? That pushes the mucus, which is normally produced in our nose, into the throat, and we swallow it. We don't realize it. Once you smoke, and once you are subjecting a person to passive smoking, maybe your kid or your wife or something, their cilia, their function is disturbed. So once the ciliary function is disturbed, there is a lot of mucus secretion. And since cilia are not working, you realize that you have a lot of mucus production also.
Okay.
Kids of people who smoke, they are more prone to ear infections also.
Okay. Why is that so?
Because again, the same phenomena, because that smoke is affecting the child's. So you are putting all the lives near you, all the lives now near you at risk.
Okay. If somebody is passive smoking, if the other person is smoking and I am not smoking, but of course it's passive smoking, what damage can I have?
Passive smokers are more at risk because active smokers, once they're smoking, they have filters in their cigarette.
Right.
Passive smoking, you are releasing out the smoke. Yeah. So all of them, they are exposed to that smoke, and this affects the lungs definitely of the smokers as well as the person who is near him. So these can cause a lot of problems, like we what we call is they have breathing issues,
Right.
which we call obstructive pulmonary disease. It becomes chronic, which is called very commonly called COPD. So they are difficulty to breathe. They have cough, which does not respond to medication also. And if you smoke in front of an asthmatic person, again he will start having breathing issues. So, and one very sinister thing is if the patient can develop, the person who is smoking can develop carcinoma, cancer of the lung.
Okay. Talking about breathing, a lot of people breathe through their mouth. And there is recently, I've been seeing a lot of ads about related to mouth tape. So, should we actually put the mouth tape, and how can we get rid of
See, you should know why the person is breathing through the mouth.
okay.
So there are a lot of causes. First and foremost, we are basically nasal breathers. God has made us nasal breathers. We breathe through our nose. If there is any obstruction, if there is any blockade of the nose, only then the person will breathe through the mouth. So you need to peep into the nose first. Why is the patient or the person breathing through the mouth? One, there could be any deviated septum, there could be polyps in the nose, or it could be some other growth in the nose which is causing this. The patient might have allergies in which everything is swollen in the nose and the patient is not able to breathe through the nose, right? Small kids, they have adenoids which lie just behind the nose, and if that is enlarged, the child cannot breathe through the nose and he snores.
Yeah.
Yeah, he breathes through the mouth, right? Then enlarged tonsils. Once the patient has enlarged tonsils, again they are hampering the airway and the patient is not able to breathe through the nose. Obese,
Okay. Yeah. A lot of
all
obese
obese
people.
patients,
Yeah.
obese patients, they have so much of fat in the neck, so that also narrows our airway, and again the patient cannot breathe, so he has to keep his mouth open. So for to see, there is no use of using a mouth tape until unless you know what is causing the breathing, the mouth breathing and the snoring. So that is of importance.
Okay.
And one very important thing regarding snoring is there are so many people. Snoring is the root cause of all the metabolic diseases. Metabolic diseases like hypertension, increased BP, diabetes, when your cholesterol is high, which we call dyslipidemias, when your thyroid is low. So all these, snoring is a root cause for all this. Sometimes what happens is a patient is having hypertension and he's visiting a cardiologist. He's on multiple drug therapy. He's not responding. And we do not know that he is having snoring and sleep apnea. I'll explain what sleep apnea is. And that is the root cause. Once you correct it, he might come on to a single drug. So that is very important. To realize that you have snoring and sleep apnea, that is very important. So what is sleep apnea? Sleep apnea is, apnea means there is breathing has stopped. So while sleeping, what happens is there is stoppage of respiration for a few seconds. And the patient gets up gasping for breath. That could be one thing. The other thing is patient doesn't realize for 10-15 seconds, good 15 seconds, he is not breathing at all. And then again, after 15 seconds, he starts breathing. That is very risky. We used to laugh it off. Oh, वो तो कराटे मारता है, हम नहीं उसके साथ सोएंगे. Karate is a big disease. It is a symptom of a disease which you need to treat. You should not laugh it off. Any patient who is snoring or any of your known who is snoring needs to be investigated why he is snoring. Why is he sleeping with his mouth open?
Right. Also, I read somewhere that if we sleep with an open mouth, it can also cause bad breath.
Yes, it can cause bad breath. Right. Like what happens is we breathe through the nose. The nose, our nose is an air conditioner. So whatever air we breathe, whether you breathe in summer or winter, What is the function of an air conditioner? It humidifies the air. It causes filtration because the nose has so many dust, the air has so many dust particles. So the nose filters the air which we take in, and it brings it to the body temperature.
Mm-hmm.
Because in summers the air is very hot, in winters it is cold, so it brings it to the body temperature. So it is an air conditioner. What air we are taking through the mouth, nothing of this is happening. So mouth is not an air conditioner, the nose is an air conditioner. So whatever will we breathe, so it will cause dryness of mouth, all the organisms, bacteria will breathe on, and that will lead to throat infections, which leads to halitosis, which is called foul breath. Secondly, patient who keeps his mouth open, he might be having some nasal issue. Maybe he has sinusitis, which is leading all to that infection in the throat also. So that also leads to foul breath.
During COVID, a lot of people had loss of smell. Why did that happen, and what was the connection between the loss of smell and COVID?
See, COVID is a viral infection, right? So what happens is when these viruses they enter the body, they attack our sense smelling organ, which is the nerves, which we have at the upper aspect of the nose, which we can't see like this. So it attacks that area. So that is why so many people lost their sense of smell and taste, because once smell is gone, you can't even taste. So that is the reason for that loss of smell and taste. There were so many people who lost, so many people who suffered very severe forms of COVID did not lose. So that is not generalized that you have that problem. So yeah, people, yes, they lost their sense of smell because of this viral infections. In fact, when you have a normal viral or a flu, you can't smell.
Yeah.
So that is viral infection, that part of the viral infection.
Okay. When should somebody come to a ENT doctor if somebody has a tonsil?
Tonsil, very common problem. Tonsillitis is a very common problem. See, tonsils, they produce a lot of symptoms in people. Like the patient could have recurrent sore throat, okay, or I'll start with kids first. So first, the child, once their tonsils are infected, they will have high grade fever, maybe 102, 103. So they have high grade fever, and they have they have so much of pain in the neck, the throat, and they are not taking feeds. So you need to see a doctor at that time. Secondly, again, if your child is breathing through the mouth, and if your child is not eating well, so you need to see an ENT doctor for tonsils. If a child's one tonsil is big and the other is small, again you need to see a doctor. So all these conditions of the tonsil, you need to see an ENT surgeon. In adults, similarly, again, if the patient is having recurrent high grade fever and with severe pain in the throat, you need to see someone of the ENT specialty. Right. And these tonsils, they become a seat of infection, so they keep on troubling you again and again. So you need to treat them.
Okay. ऐसे बोलते हैं that ठंडा गर्म पानी नहीं पीना चाहिए. Hot and cold water can cause tonsils. Is that true?
That is true. Whatever is close, the temperature which is close to our body temperature should be taken. Neither very hot, neither very cold. And yes, that causes this. Sometimes you take a ice cold shake or something, and your voice gets changed. So yes, you should not take it. And similarly for hot things also, because you must have seen during COVID times people are taking so much of kada and everything, yeah. So and hot things. So but these things, they should be avoided because they damages the lining of our stomach, and it causes hypersecretion of acid. And once a hypersecretion of acid occurs, there is a condition which is called reflux. So that reflux causes changes in the throat or damages the throat, and you can have some problems, itchiness and pain and everything.
So excess of these drinks can
Yes,
be
yes,
dangerous.
it can lead to. In fact, certain ice cold things can lead to a condition called laryngospasm. So there is spasm of our airway, and that can lead to cough also. So you should avoid taking things which are too cold or too hot. Something close to the body temperature is fine.
Okay. If someone is a musician, what are the precautions they should take?
A musician, a teacher, these are all professional voice users. They depend on voice for their profession. So they need to take care of their voice. Firstly, they need to keep themselves hydrated. Drink lots of water, right? If a teacher has a lecture, 1 hour, drink a glass of water before the lecture, another glass in between, and one glass after the lecture. They need to avoid spicy foods, chilies, right? Deep fried foods, ice cold water, very hot tea, and caffeine containing like Coke, and excess of tea and coffee, because all these cause dehydration. So you need to keep yourself hydrated. That is the most important thing. You also need to use your voice judiciously. Talk only when required, and avoid excessive talking. Do not speak in very loud voice, or do not whisper. Yeah, so it should be in your normal tone. And do not shout at kids. For ladies, do not shout at kids, because kids will remain kids only even after shouting. So do not exert.
But during practices, voice modulation happens. So how can we, because apne bola do not shout, so we have to increase our voice and all of a sudden we have to decrease. How can
Those are professional users. That is their normal practice. So that is that part of that is part of that. In case you feel that your voice is getting damaged, you need to do breathing exercises. So yoga, pranayam, alom vilom, all these help. So do breathing exercises, and sometimes neck massages. Sometimes when the patient is under stress, like you have a stress to perform, right? Like a musician or a singer has a stress to perform. Again, that also leads to some voice changes. So try to be relaxed, and regular exercise for that. Meditate, and just be on your own.
Right. So stress can actually cause
Yes.
a lot of. I've seen a lot of singers in their interviews say that one hour or one day before the event, we lost our voice. So this.
Yes, stress can cause.
Okay. Okay. ठीक है. Often, small kids, infants, they're eating. Sometimes, they're eating and something falls down on the ground. They pick it up and eat. Is that the right thing? And people say that it's their immunity is going to increase. Is that true?
Yeah, that is true.
Okay.
That is true.
Hanji.
What happens is when a small child, you compare two children, a small child who has been brought up in an environment which is neat, clean, tidy, all spick and span, he is more prone to infections and allergies.
Okay.
Yeah. And a child who has been brought up in an environment which is dusty, not so spick and span, not clean, he suffers from less allergies and infections. So let the child eat. It improves his immunity. So the mothers need not be finicky about it, need not boil everything. Okay. So because this starts from childhood itself. So that increases the antibodies in the blood. It improves the immunity of the child, and such children are less prone to infections in adult life. I don't mean that you put everything in the mitti mein dal ke khilao, but don't be so finicky about it. Yes,
Right.
you need to wash. You need to wash whatever you are. It should be properly cooked. But then don't be finicky. If a child picks something from the floor and the ground and eats it, nothing to worry. He's eaten. And in fact, if he suffers from some infections also, so that again are improving his immunity.
Okay.
So some minor infections, they can be taken care of.
So most often, while kids are playing, they would put their toy in the mouth. So, what are the precaution parents should take?
Once children they are very curious. Right? So whatever they find, they put it in the mouth, especially at the time when they are teething. So whatever they found, they're crawling, they pick something, put it in the mouth, right? So there are two things what can happen. If they put it in the mouth, it might go into the food pipe, or it could go into the windpipe, right? If it goes into the food pipe, right, and if it is a small piece of toy, or it is a coin or a something, yes, the child will have some difficulty in taking food. That can be removed. So that is also, we need anesthesia and we remove it. But if a child is put something in his mouth and it has gone into the windpipe, that is dangerous. So, because the patient's air passage is being compromised, so he can have a sudden onset of respiratory difficulty. He can turn blue. Sometimes some kids are left unattended. Like mother has gone to the kitchen to work and the child is playing with toys. So there are small blocks nowadays, or mother has given some pomegranate to eat, or has given some nuts to eat the child. So what happens is the reflexes of children are very poor. So he might inhale the foreign body, inhale the almond or a peanut, right? So that would go into the respiratory tract, into the windpipe, and that could prove fatal. First and foremost, never leave a small child unattended, especially he's playing or he is having food or something. Never give children less than 3 years nuts to eat. Nuts, bhujia, dry biscuits, anything. So these things should not be given to children to eat, because these children have a tendency to inspire these or inhale all these foreign bodies. And if a child, if you feel, has taken something in and he's not breathing properly, or in fact, even if you feel that he has taken something and he's coughing, get him to the hospital immediately. Do not wait, because we need to remove that foreign body as soon as possible.
There's this very common problem in the US that I saw was people having nut allergy. Why does that happen? And is it related to our environment or our immune system?
Nut allergies are common in US, not in India. In India, people are allergic to pollens. So there are lots of pollens to which people in India are allergic. And there's one very common grass which is there all over Jammu, also Congress grass, which grows up anywhere, right? That is, so that people are allergic to those things in India, right? Some food products like milk and eggs, some cheese, that is again milk product. So people in India are more allergic to these things.
Okay. Can gluten be a cause?
Again, this gluten allergy is a common cause in Western countries, not in India. Not in India. So these allergens, if your child is allergic or you are allergic, so these need to be picked up, and you can get specific antibodies to this, which we call as immunotherapy. And this immunotherapy can take care of your allergies, though the time period of the treatment is long, and but then that allergen can be identified and then treated accordingly.
Okay, and how does that immunotherapy work?
Because immunotherapy, what happens is we give the allergen in very minute doses. So once it is given in very minute doses, that antibodies start being produced inside the body. So that helps in. That is called immunotherapy. We are improving the immunity of the patient.
So moving forward, there's something called vertigo. What is vertigo, and why is it increasing rapidly?
Vertigo means chakkar aana. That means you have a sense of rotation.
Right.
You are sitting and you feel that your entire environment is moving, or you yourself are moving. So that is vertigo. There could be a lot of causes for vertigo. So it could be causes related to the ear. Vertigo could be because of ear conditions, or it could be something in the brain, right? Second part of the question is that why has it been increasing? It is increasing because it is being identified now. Initially, it was not being identified. Old ladies with मुझे चक्कर आ रहे हैं, and then people used to say आपको कमजोरी हो गई है, आप रेस्ट कीजिए, आप ये कीजिए, आप खाना खाइए, and they used to take them to the hospital. They would give some glucose की drip लगा देते, हाँ जो drip लग गया, now she's better, right? So now it is increasing because we are identifying that this is vertigo. Secondly, because of increase in population, the substantial increase in hypertension, which is also causes vertigo. That is another thing. Secondly, now it is being realized that vertigo is not only because of blood pressure, it is because of some ear-related disorders, and newer disorders are being identified. So that is why there is increase in the number of patients with vertigo nowadays.
Okay. So I was supposed to do like a backflip. My head was down and my legs were So it was something around those lines, and that's when I got vertigo.
See, what happens is our ear has three parts. It has the outer ear, which we see, the middle ear, which is responsible for hearing, we hear, and the inner ear, which is responsible for hearing as well as balance. So, balance is a very important function of our ear. So, our ear has very small particles. There are some canals in the ear, which are, there are small particles in these canals, which are gravity sensors. They sense gravity. They tell us, yes, there is gravity, you have to walk like this. Now, what you were trying to do, you were going anti-gravity. You were placing those particles in the anti-gravity position, and they got confused.
Okay.
So that is why you had vertigo. So all those people who move their necks vigorously, or do a backflip, or in yoga they do that upside down pose. So these all are predisposed to having vertigo because those particles get displaced. Any jerk on the head, like in patients who have a head injury while on a road traffic accident, when you have a sudden jerk on the head, again those particles, they get dislodged, and that can cause vertigo. Though there are other causes of vertigo also in patients who receive head injury, but that is one cause of vertigo.
Okay, and how do you balance them?
So, if you have vertigo with changes in head position, that means those particles have been displaced, and we need to do some exercises on that because we need to replace those particles back into their place. So, we need to do some exercises on that. So, that is how we replace them back into their original place.
So can it be done at home, or
No,
we need to come to an ENT?
no. These cannot be done at home because the exact angles, the exact movements, they cannot be repeated at home. So you need to see a ENT surgeon or a neurologist who is practicing vertigo. They can help.
Okay.
That is one cause of vertigo. Other causes of vertigo related to the ear, there are sometimes vertigo occurs. You have a bout of vertigo and your ear also becomes heavy. You stop listening from one ear. So that is a condition which is called Meniere's disease. And you have vomitics. That is one condition. Sometimes people who have migraine. So the people who have migraine also get vertigo during an episode of migraine. So that is a very common cause which has now recently been come up because patients used to initially मुझे चक्कर आ रहा है, मुझे सिर में दर्द हो रहा है, and used to be labeled as migraine. But now this is another cause of vertigo. That is called migrainous vertigo or vestibular migraine. So that is another cause which is coming up. Then we have another, then sometimes there is some erosion in the inner ear and all those things, they can also cause. Certain drugs,
Right.
like people who take sedatives,
Okay.
like anticonvulsants
Mm-hmm.
and antidepressants.
Right.
So that patient keeps on having chronic dizziness, feels unstable. So there are certain drugs also which can cause vertigo.
Okay.
Anemia, very common cause in females in India.
Right.
So it is very commonly missed. So
Right.
that is one cause of dizziness.
Okay.
Yeah. So that is very important.
Right. Similar to this, there's something called tinnitus. What is it? And how can we get rid of it?
Tinnitus is when you have a ringing sensation in your ear starts buzzing. It appears as if a water tap is open or cooker ki seeti baj rahi hai, or there are bells in the temple. So right, that bell sound, or it could be something which is synchronous with your heartbeat. Dhak, 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 dhak. So it is like that. So tinnitus is any abnormal sound in the ear, right? And this is a lot of causes again for tinnitus. Could be ear related, obviously ear related causes. And sometimes you have some malformations in the brain, there are malformations of the blood vessels in the brain which could cause tinnitus. And hypertensive people or anxiety. Yes, anxiety can also lead to vertigo also. So anxiety can lead to tinnitus also. Right? So these people, they can have tinnitus. People who are using earphones, they also develop tinnitus, right? We have so many young people, young generation using earphones. They come with tinnitus, and that is the initial sign of hearing loss. So the patient starts with tinnitus first and then has hearing loss also. So these are the major causes of tinnitus you can have. So if you want, you can it is only by taking care of the health of the ear, like you avoid loud sound, avoid using earphones, and avoid trauma to the ear, right? Then there are certain drugs also which cause tinnitus. Do not self medicate yourself, like analgesics. They can damage your inner ear, they can cause tinnitus. You have heard the name gentamicin, namicacin. All these, they also affect the inner ear. They can also cause tinnitus and hearing loss, right? Then certain anti-malarial drugs, drugs which are used for cancer, chemotherapy, that can affect. And there are certain drugs which are used to clear the kidneys to increase urine production. They can also cause tinnitus and hearing loss. So whenever you have such problem, the problem is in the initial state, always see your ENT surgeon. Always better to get it treated early rather than making it a chronic problem. And in fact, when you talk on the phone also, this is another point I would like to add. Okay, for tinnitus, if you are using your mobile phone for a longer time, so that can also lead to tinnitus. So you always speak, if you are going to talk for a longer period of time, put the phone on speaker mode.
Okay.
And then talk.
Nowadays, drugs are on the rise. And there's this common drug that people are taking, that's cocaine. And it's been taken from the nose, snorting. What kind of harm does it cause to your nose?
See, cocaine is an anesthetic. It numbs your nose. Okay? And once you take it frequently, it produces a perforation, a hole. It produces a hole in the nasal septum. The nasal septum is a partition in between the two nostrils. So it produces a hole in the nasal septum. So there are people who are cocaine abusers having holes in the nasal septum. Now, what does this hole cause? What happens? This hole is not normal. So what happens? The air, whenever it strikes the nose, it produces crusting on that area, and it causes bleeding. So that is a common thing which happens in patients who are cocaine abusers.
Why do people get nose bleeding during summers?
Nosebleed is a very common problem in children as well as in adults. So there are different reasons for nose bleeding in children and adults. And nosebleeds in children is commonly seen in peak summer and peak winter, especially when the air is very dry. And in those people who have some nasal issues like a deviated septum, which I've already talked before, there is a small blood vessel in the anterior part of the nose. So once the dry air touches that part of the septum, it becomes dry and it starts bleeding. The vessel, it ruptures and it starts bleeding. This is a very common problem, commonest. Another common problem is patients who have high BP,
Okay.
who are hypertensive.
Right.
They also bleed, and they have profuse bleeding from the nose. In elderly also, once their blood vessels, they become calcified, which we call atherosclerosis, they get sclerosed, so they become very fragile and they also start bleeding. There could be some tumors in the nose which could cause bleeding. In fact, patients with sinusitis, they can also have bleeding. So these are some common problems. Some problems. There are certain drugs. People who are on blood thinners. We have so many people. We have elders in our houses who are on blood thinners. So that blood thinning drug would also cause nose bleeding.
Okay. And how can we prevent it?
See, when nose bleeds can be prevented by you can keep the nose moisturized. Once the nosebleed occurs in the peak winters and summers when the air is very dry, you can use commonly available Vaseline petroleum jelly or any other lubricant, for that matter, any oil. So you can just apply it inside the nose and keep your nose moisturized and keep yourself well hydrated. So that is one point. Hypertensive people, those who have high BP, they need to keep their blood pressure under control. And if you having recurrent bleeds, then you need to see an ENT surgeon, because we will peep into your nose, do an endoscopy, and see why you are bleeding from the nose. It could be some other problem also.
Thank you so much. It was lovely having you.
Thank you so much for calling me over.
Okay.
You're most welcome.
Like,
Share
subscribe.
to Dopamine High.
Thank you.
Thank you.